everyone to this new episode, and we have here with us Dr. Kelvin, and unfortunately Alina is not able to join us at this time, and she may just pop in a short while, and hopefully she's driving back from somewhere. So I've known Dr. Kelvin, I know of him, it's got to be about 20 years ago, because my daughter is almost 20 now. Dr. Kelvin, by the way, is a chiropractor. So I remember going into his office and I brought my daughter along. And I think that was the first time I met you, right?
Yeah, that's right.
We've kept in touch, basically also because I've been receiving your newsletter over the pandemic. That's where we kind of restarted like communicating, right? And sharing info and all of that. Yeah. So how have you been? How has life changed since I saw you?
Well,
20 years ago?
I think mostly it's still quite the same. It's just that we noticed that the patient flow has slowed down a bit because of a pandemic. I think the pandemic has hit everybody very hard.
Yeah.
In terms of spending, in terms of finances.
Yeah.
I think people are cutting back on their spending.
Yeah.
Also because of all the work from home arrangement. And a lot of people are not coming to town.
Yeah.
So they pretty much spend most of the time in their maybe hometown. I mean the area they're in, and to seek care may be a bit more troublesome.
Yeah.
So we noticed that there has been a bit of a drop. Yeah.
Okay.
In terms of number of patients that are coming. But ironically, more people are in pain because with their work from home arrangement, the economics are terrible. And many people will just, they will work on their dining table, or sometimes they'll just bring their laptop and sit on their couch and just hit their laptop away. And that's where they get a lot of aches and pains. And of course, the aches and pains will then remind them to come and see me. Like a little reminder.
Okay. So, in your practice, I know that you are a family chiropractor, right? So you don't specifically deal with just one age group. You deal with like everyone from all age groups.
Yeah.
Okay.
Right. So my clinic sees babies. I mean, even before that, pregnant moms who require care. And anyway, to newborns, and then to toddlers, and then to working class, elderly. And then we see a lot of athletes as well, even some of the elite athletes.
Right. Okay.
So both my staff, Dr. Ashley, and I, we are both certified in paediatric care and pregnancy care as well.
Okay. So that's not common at all, right? As a chiropractor in Singapore, like.
Well, to get to see pediatric and prenatal care, we need to get extra training. And like myself and Dr. Ashley, we both got certified in prenatal care, especially, and then we have to go for extra classes to learn, the safety aspect of adjusting a baby and a child. Because the adjustments are very different, and there are some do not do things for when it comes to treating or adjusting babies and pregnant babies.
Okay. Yeah. Well, the art of chiropractic care is really becoming more and more known in Singapore, right? And and I do see that there are clinics popping up all over the place.
Yeah.
But as a layperson, right, we won't know whether a person is certified to care for pregnant moms or babies, right? We presume that everything is under one big umbrella. Yeah,
that's right. That's a very important point because in Singapore, I think there are probably over 200 chiropractors at the moment. And then many of them, they don't advertise their credentials, like where they graduate from, whether they're really qualified. So we have this Chiropractic Association of Singapore, which was incorporated or was put together in the late 80s. So what this association does is that we, firstly, for any chiropractor to join as a member, we have to assess them. We have to make sure they turn in all their diplomas, certificates, and to make sure they're all qualified. We will write to the country of where their college, where they graduated from, to get them to send us their credentials to make sure that it's legit, and then they're all qualified. And then we'll try to find out whether this person previously was sitting like a unlicensed chiropractor anywhere in the world. We will
Right.
ask them whether they have a good standing. You know,
Okay.
if they maybe got somehow like the license got revoked or something, then of course they can join us. But the biggest
Okay.
part is that we have put in place a very detailed ethical code to make sure that these chiropractors, they cannot use scare tactics. They cannot sell huge packages. They cannot make sure every chiropractor, every patient takes an X-ray, which is what a lot of this many of these chain chiropractors are doing. And
Yeah.
of course, they can't sell huge packages.
Mm.
Because a lot of these clinics, they are using fear to get
Yeah.
patients to commit to a package, a huge package.
Right.
What happens then is that they come in and then they dictate, how frequently the patients come in. Like maybe it can be up to 3 times a week, which
Right.
sometimes may not be necessary. Or I would say most of the time it's not necessary.
Mm.
As a result, some of these patients may get over adjusted, and their healing may backfire. Yeah, so we have like in within the Chiropractic Association, we have about 20 members now who have been assessed to be qualified, and they have agreed to abide by the ethical code and conduct of the chiropractic.
Okay. So there are 200 practitioners in Singapore, but only 20.
Yeah.
Wow. So does that mean that, without being part of the association, they're still practicing?
Yeah,
So there is no way for anyone to know whether they're really qualified unless they go digging in.
Yeah. So the best way to to check, if you want to to see a chiropractor is to go to the Chiropractic Association website and
Okay.
have a list of chiropractors who are members, professional members. So I'm a board member of the association, so we are very well aware of who are members, who are not.
Okay.
Then there's one thing that I want to mention also is that recently there have been a lot of reports of chiropractors want to be. Yeah, somehow they went online to attend some courses to learn how to manipulate the joints, and then they would claim themselves to be a chiropractor, and they will run some maybe a clinic or some sort of setup in their homes, and then they would do a lot of like YouTube and maybe Instagram and hashtag themselves as chiropractors.
Oh, wow.
And it's quite scary. I mean, you just imagine the kind of manipulation that they do without going through a proper education.
Yeah. Pretty dangerous.
Yeah, and then
We hear of like people who got injured going to a chiropractor.
Yeah.
So then it's like bad press, for.
Yeah, that's true. There are also some recently there are some misunderstanding where the chiropractic profession is a very separate and distinct qualification and also a profession. But within the TCM, there seems to be a misunderstanding that chiropractic is equivalent to bone setting, which is different.
Yeah.
So many TCM clinics these days, they tend to advertise themselves as chiropractors as well.
Yeah.
Of course, I believe there are genuine maybe misunderstanding instead of those chiropractors want to be. Those are probably a bit more intentional. So for those TCM clinics that have been reported to us, we usually will write to them to let them know that there is maybe a slight misrepresentation. And they have been usually very cooperative. Like they will change their signs immediately. Yeah.
Okay.
We have been able to address these concerns for these clinics. But those who are they are not qualified, but then they still go about doing those their gigs at home. Those are the ones to be really careful about.
Okay. So for the safest bet, right, for anyone who wants to find a proper chiropractor is really to go to the association. So we will have the website flash across, so people can just go or check the description box in below. to go and check it out and
Yes.
contact Dr. Kelvin. We have an international audience, so obviously it's difficult to do any care for people long distance, but is there anything that you offer for people like long distance?
Yeah, I do some, I mean, for patients who are receptive, I do some remote adjustments. This is quite unique, but only for some patients who are maybe into energy healing, or they're open to, or maybe they're stuck in certain locations where
Right.
they may need some help.
Okay.
Because this is not really within the chiropractic realm of adjustment, but it's just
Okay.
with this technique that I'm doing, we have a protocol. Yeah.
Mm.
For such cases, we are able to extend some help to them. But of course,
Ah,
the preference would be to have them to come to my clinic.
yeah, of
To do
course.
physical adjustment.
Of course. Of
Because sometimes,
course.
I mean, healing can be. There are many different types of healing. Some people believe in energy healing,
Yeah.
which can transcend distance, right?
Yeah.
It doesn't
Yeah.
really matter where you are, like Reiki or
Yeah.
other forms of healing art.
Okay. So are you a Reiki practitioner as well?
But I work with a lot of Reiki practitioners.
Okay.
So I'm very open to what they have to offer, and then they're also very receptive to my kind of care.
Mm.
So I think it's a good thing for the healing world.
Okay.
Because after all, we want the best interest, right? Anything that can help them.
Ah, okay. So you do have the Reiki practitioners coming into your healing space as well to work
Yeah.
with you?
I mean, they do refer patients or clients to us.
Okay.
Sometimes they may have some blockages that we able to help from chiropractic angle.
Okay. All right. Ah, okay. Interesting. Yeah. So people just need to check out your website just to.
Yeah, that'll be good.
Okay.
But one interesting thing that I also realized, partly arising from the pandemic, is that a lot of people are stuck with their economic setup at home. So that gives me a bit of motivation to recently get certified to be an ergonomist.
Oh, wow.
So I went ahead because I for chiropractic in my clinic, I have a lot of patients who come in to get help for their posture. So we can do the adjustments, not a problem. But sometimes with the repetition of their bad posture and the demands of maybe their work ergonomics, they have no choice but to be always slumped in the same position. Sometimes the employee may be given a very bad setup. The small table where they have an armrest that prevents the chair from going into under the table, or most of them are using laptop these days, and people looking down, and with all the smartphone and devices, right, they're always looking down. So their muscles are they're programmed in the wrong way, where they have this what we call flexor dominant effect, where always looking down causes their front part of the muscles to be too tight or too strong, but their back muscles are quite weak.
Okay.
I have gone on to also get certified to help retrain all these muscles.
Okay.
I started offering this posture exercise program for some of my patients as well.
Okay. Okay.
Along with their ergonomic resetting, it actually helps them. Just imagine they are spending hours and hours in front of a computer every day.
Yeah. At least 8 hours, right?
Yeah.
And after they leave the workspace, they're on public transport again. And then when they're having their meals, they're on their phones again.
Yeah. And just imagine the only time they get a rest is when they're lying down, they're sleeping.
Yeah.
That itself is another problem as well, because the pillow and mattresses are often neglected as well. So if you have a pillow that's not fitted well, and you end up cranking your neck the whole night, your spine takes up a lot of stress.
Yeah. Okay. So for people in their midlife, is it harder to adjust and to retrain, or the work is still the same? Or, bad habits, right?
Yes. In fact, for midlife people, all these issues could have been there for donkey years.
Oh, yeah.
If we look at the spinal development, right? So once a baby is born, or even before that, if a baby is being conceived sits in the mom's tummy and the uterus, right? And then if the mom's pelvis is kind of rotated in, sometimes the baby gets cranked up in the wrong position. So that
Right.
could be sitting there for many months. And then during the birth process, sometimes for some babies, it can be a bit traumatic where the birth
Yeah.
canal might be a bit narrow and the gynae has to do a lot of tugging. So that
Yeah.
itself can set up a misalignment in the neck as well. So that was a study that was being done by a medical doctor many years ago. He found that when there's a intervention in the birthing, there's a 95% chance that the firstborn can become misaligned. Yeah, so babies are usually not checked until they have maybe some symptoms, or some of my patients, because they've been under my care for a while, so they want, like my clinic is a family clinic, so they bring the baby in for a check as well.
Yeah.
Then of course, as babies develop, sometimes parents, being first-time parents, they're not comfortable with handling the baby. That can set up more stress in the spine as well. And as they learn to walk, they fall on the butts, and that also can introduce a lot of stress. Then going to school, carrying heavy bags, so maybe some falls here and there. And then as it accumulates, when we get to the midlife, and most people then tend to have, with all this misalignment already building up since young, they start to develop maybe some aches and pains.
Yeah.
And then that's when they come in for help. But some can maybe come in at 50s, 60s, but then by then, imagine the muscle programming has been there for a long time.
Yeah.
To be able to help them is a good thing, but then some patients, they need also to manage the expectation, because just imagine these misalignments have been there for so long.
Oh yeah. Yeah.
If I were to see a baby or a child, the misalignments are there for a shorter period of time, so they tend to respond a lot faster.
Okay.
And of course, if we compare a child's spine and a midlife spine, if they don't do anything, you have the midlife spine with all this accumulation, like a snowball effect, right?
Yeah.
Babies will be okay, just maybe a few years. We adjust, we can reprogram, then that is good. But then with this midlife people, in addition to having all these misalignments, every day they are sitting in their office, they are doing all this wrong posture, and it's like a catch-up work most of the time. If you don't start treating them or adjusting them, then they're probably going to just get worse, and sometimes it can develop into accelerated degeneration or disease or muscular.
Okay. Are there exercises that you introduce to people, like they can do on a daily basis? Because I think I saw a video of you on LinkedIn.
Yeah.
With simple exercises. So that's something that people can also do, right? They can look for you on LinkedIn. Do you have a YouTube?
No, maybe I just that one.
Yeah. So, but they can look for it on LinkedIn, right?
Yeah.
Yeah.
And my Facebook page also. Yeah.
Okay. Yeah.
So I do I started introducing this posture rehabilitation exercise maybe about 1.5 years ago.
Okay.
Particularly to target these patients who need help with postural stresses.
Yeah.
So I have incorporated a program that's about maybe 10 to 12 sessions where we work with the patients one-to-one.
Okay.
And then every time I'll introduce a couple of exercises to help rebuild those or wake up those muscles that have not been used for a long time. So it's like a very structured way we build from bottom up. And we use exercise balls as well.
Okay. So even people who exercise, they can be programming their muscles in a fixed way because of the exercise.
Yeah, maybe the wrong way, not the intended way.
Yeah. Okay. And then then issues can also surface. So teaching them or helping them reprogram the muscles is also another thing that you do, right?
Yeah, it's like a roadmap to get to where we want. But if you go into the gym and start working out on your own, it will just be for that particular area, but not there's no structure to build the muscles in the right way.
Okay. Wow. Okay. So do you work closely with personal trainers?
Not yet. Yeah. So that's one area that I may want to tap on.
Okay.
It's just about reaching out to them and letting them know that that's the sort.
Okay. So Alina is a fitness coach.
Oh, okay.
Yeah. So she is, a lot of her clients are midlife.
Okay.
So she's, in Australia, they do their training. She used the beach, so they do their workouts on the beach. They go to the gym and all of that. So a lot of midlifers, I see her photos right on Instagram and all that. Her clients are their midlife and, maintaining fitness or starting fitness regime. Yeah.
So
So
that's
that's,
so interesting. Yeah, that's good.
yeah. So, for your clients, majority of them, do they, like people in their midlife, right? Do they exercise or they're usually people who don't exercise?
There are, I would say, two extremes. There'll be those who have no time,
Yeah.
that's just so busy with work, and then just every day go into the office, and then the next thing they know is like maybe 8, 9 p.m. They hardly get out of the office. They don't get any sunlight as well. And there will be those who are so into fitness, like every day they'll go to the gym and do some workout, maybe
The other extreme.
extremes. But then
Uh-huh.
some of these patients who go to the gym every day, they are also seeking some kind of relief from their aches and pains. So we always tell patients that if you find yourself like you're taking a day off from your gym exercise and you start to feel pain, then that's not a good sign.
Yeah.
There could be something going on.
Yeah.
So some of these people, they may be looking for endorphin release.
Yeah.
Exercise, you feel great, right?
Yeah.
Feel good, yeah. So some may be kind of masking the problems that they have.
Yeah. And then they get all sorts of inflammation and then it just gets worse and worse, right?
Yeah, and worse will be those weekend warriors. They don't they don't exercise at all. Then some would just like maybe when some friends encourage them to join like a half marathon without training, they just buy a pair of new shoes and then go run and walk, and the next thing they know they're in severe pain, and then they'll come and see me.
Yeah. If you're in severe pain, it's not so bad. There have been people who, without any training, who go and do this kind of running long distance and then they collapse, right? And then, yeah, it's just, yeah. Okay. So, if people want to look for you, they want to know more about the Chiropractic Association, where they can check out other chiropractors or check out the services that you have, they can look for you via I'll list down all the social media connections, your website.
I can list my website, and then I
Yeah.
can list my contact numbers as well.
Okay.
For
Okay.
those who may be interested in the posture exercise, I have a write-up as well.
Mm,
I have a few case studies that I show before and after.
okay.
Because this has to be evidence-based. It's not like, sometimes when you go to get some exercise regimes or programs, uh, there may not be a proper measurement. So with this posture exercise that I'm doing now, we do take pictures like before and midway through and after. So that way we can show whether there's a change. But so far, the cases that I've done, there have been reports. I mean, we have measured them before and after. So we can see their posture earlier from this way.
Um,
So that they feel a lot stronger in their
Okay.
body.
okay. So are your clients mostly male or female?
I would say majority will be female.
Oh, really? Okay.
It's interesting that men usually would be a bit more hesitant to come in, but then when they do, the only time I would say that when they come in, they are usually in quite a bit of pain. And I would see patients who tell me, "Oh, my husband needs to come in. I've been telling him he's not coming. He has no time." Then the next time I get a call from the husband, it's like, "Oh, I'm in so bad pain. Can you see me today?"
Wow. I'm quite surprised that more women, because I often hear men, right? Men in general like to go for massages. Like they will seek out, like if they go for holiday, they like to go for massages because, they feel like there's a lot of tension in the body and they need to release.
Yeah.
And so, like, massages is a thing that they go to, but why not a chiropractor?
Yeah. I mean, massages are not just massages, but hardcore massages and
Oh,
some
yeah.
tissue massages.
Yeah.
And these days, I hear of many patients who go to like Malaysia or Thailand. they get those Thai massage where they do a lot of manipulation, and they find that, oh wow, that's nice, you know. Yeah. But recently there was a report of
Yeah.
some people getting badly injured.
Yeah.
Yeah.
Because they're not really trained.
They're not. They go by gross manipulation. And you know, if they don't sit down and listen to or go through a medical history, and they're not
Yeah.
even trained to examine a palpate spine.
Yeah.
Basically, they just feel your muscles and just go about with a brute force, and that can cause a lot of damage to the spine.
That's pretty scary.
It is. Even, like even if someone goes for like a haircut, you shouldn't let the barber or anyone work on your spine.
Yeah. I think that's like a trend, right? Where more and more like they want their the neck adjusted or like massage or whatever. Yeah.
Yeah, I have heard of clients getting a $2 manipulation by a barber for extra $2. Pop pop.
Oh no.
It's quite scary.
It is
But
scary.
I think consumers also need to have the awareness that their spine is too precious to let anyone who's not qualified to even touch them.
Yeah, exactly.
I used to have this when I came back to America. I came back from America. I went downstairs and I saw this makeshift store. So this guy was trying to sell his service as a foot reflexologist. So I thought, oh, interesting. Why not, right? I mean, it's for relaxation. So I sat down and then he did a foot massage and he said, so would you like a cracking of your spine? Yeah. What do you mean? And he said, I can crack your spine. Work on your neck and your back. I said, wow, that's interesting. How did you get this qualification? Did you go to a university or something to get certified? So no. I just went over to Hong Kong. I have this Shifu, right, master, who will teach me for like 3 weekends. And then he even showed me his notes. Like, see, this is my notes. I said, wow, then your master must be quite qualified, some professor, right, to be able to teach you in within 3 weeks for you to start doing this for people. And he said, no. This was passed down from his family, his generation to generation, and then he's like a grandmaster now. And yeah, you just pay for a course pay for the course and we'll train you. And that's it. And I said, oh, wow, that's interesting. But I said, but I don't think you want to touch my spine. I said, why not? I'm qualified now. I said, I'm a chiropractor. My specialty is to work on the spine. And he's like, his jaw drops. Oh, yeah, touch your spine. So it's quite scary how then he went around doing that for most of his clients.
Yeah. We mustn't let anyone just touch us with it, especially if they don't have the qualifications. It's scary. Yeah, cheap is one thing, but your life is not cheap.
Yes. And also don't crack your own spine, because a lot of people like to do this.
Yeah, I've seen that.
To pop their back as well.
Yeah.
And sometimes they even get friends to pop their back.
Yeah.
There was a piece of news in the Straits Times that someone manipulated a friend and then he got into trouble.
Wow.
Yeah. So just be careful. Your spine is too precious and too sacred to let anyone touch it.
Yeah.
So the best is to see a qualified person. Okay. And not just a chiropractor, but a qualified one.
Yeah. Okay. Well, thank you for sharing all that information. Okay. You have shared a lot already, a lot of info, a lot of educational stuff, but anything else you want to share with people?
Well, I think in this time and age, we have to be careful with the information that we are exposed to. Just always have an open mind, and whatever that is being fed to you, maybe in even the social media or the mainstream media space, don't just take absolute truth from it. And especially in places where there are limitations as to what you can read, just find alternative sources. And when someone shares information with you from an alternative angle, just have an open mind and look at it and not just share it. I think we've been through the pandemic phase, and right now it seems like there's a lot of information that's being released that may change people's perception of the information that we were being given.
For sure. Yeah. Thank you for that. Yeah. And this is Shamala signing out from Singapore.
This is Australia signing out.
Yeah. So bye everyone.
Bye. Nice to meet you, Kelvin.
And yeah.
Yeah.